besides extending the foot, it also extends the digits. That's the extra function. That's one. Second, so besides flexing the foot, all those four muscles, okay, so we have extension of the toes, lateral four toes, that's one. Second, then we have if the muscle or the tendon inserts medially, or if the tendon inserts laterally. If they insert medially, they would pull, and so, right, they would invert the foot, okay? So this would go, so this is medially, this is medial, this is lateral. So if it's on the medial side, when they pull it, they would invert, okay? If it's lateral located, they would do what? Evert, okay? So basically, in the anterior compartment muscles, we're talking about the insertion point of the tendons of the anterior compartment muscles, the muscles. So we have tibialis anterior, you see, it attaches on the medial side. And then we have peroneus tertius, it attaches lateral side. So, okay, so besides dorsiflexion of these four muscles, we have tibialis anterior, also invert, okay, besides dorsiflexion. And then we have peroneus tertius, evert the foot. Is that clear, everybody? Okay. So basically, all the anterior compartment muscles are what? They dorsiflex or extend the foot, plus invert the foot, plus evert the foot, plus extend the fingers, okay, the toes of the foot. Okay, so these are the extra functions. All right, and these are all innervated by deep peroneal nerve, right? Okay, so if they normally extend, okay, so they now extend the foot, right? So if this nerve does not work, they won't extend. So what will happen?
Foot drop.
Okay, so how would it occur? Foot drop. So if this is like this, so they would have difficulty in lifting the front part of their foot. Okay, so they would have difficulty in walking, right? So what should they do in order to walk? So they have to lift their thigh. So they lift their thigh and then do this. Lift their thigh, do that. Okay, sorry. So they have to lift their thigh and then press their foot on the ground. Why? Because their foot, it's not coming up. Okay, so that is what? A foot drop. Okay, so this foot drop, so you would see foot drop due to the damage of what?
Deep peroneal.
Okay, so do you have like foot drop if you damage like superficial peroneal nerve?
No.
Do you have foot drop if you have like damage on the tibial nerve?
Yeah.
Okay, so foot drop is equal to what? Deep peroneal nerve. You got it, right? Okay, so you would also, so how would you experience this foot drop? Or yeah, like you would have a damage, like we said, you would have a damage of the deep peroneal nerve, and where would you see that damage primarily?
Anterior muscle.
Right. For instance, if the common peroneal nerve wraps around the head of the fibula, okay, on laterally. So if you have a damage in the fibula, the proximal part of the fibula, and for instance, at the level of the head of the fibula. So if you have a hit, a blow, a trauma, or accident, car accident that would break there's a fraction there, at the level of the head of the fibula, and at that level you have the common peroneal nerve. But later on, the common peroneal nerve divides into superficial and deep. So the superficial, basically, it's lower, and then you might have a fracture in the neck area. You might have a fracture in the neck area. So neck is primarily, so if you have a fracture in the neck of the fibula, you would affect which part of the nerve?
Superficial.
Right, superficial. Okay, So you would affect superficial. So deep goes deeper. So that would escape. It would escape. But if you get a fracture on the head
Both.
of the fibula, so both will be affected. So the common peroneal nerve will be affected, and therefore you would have what? A foot drop at that particular time. So that's the anterior compartment. Okay, let's look at the lateral compartment. So these are the lateral compartment. We're going to look at these one by one. Again, like I said, the origin insertion, and these are basically that's what. So this is so they go to the lateral part of the foot. Okay, and when they contract, they would do what?
Evert.
Right, it would evert. So if the nerve is damaged, so what would you see in that person or patient?
Inversion.
Okay, so we can't just say, right, they can't evert, but how would you see it in an appearance of that particular person? How would you?
Inverted.
Right, the foot would be inverted. Okay, so normally, so if that function is not applied, then you would see the opposite. Okay, the opposing functions, the opposing muscles would be dominant, and the foot would be inverted. Okay, inverted. Okay, so that nerve is superficial peroneal nerve. So if you have a damage to superficial peroneal nerve, in which cases?
Clubfoot.
Like the fracture of what?
No.
The neck of fibula.
Neck of the fibula. It damages superficial peroneal nerve. That would damage these two muscles. So you don't have eversion. What would you have? Inverted foot. And we call that what? Clinically?
Clubfoot.
Clubfoot, but specifically is what? Talibes?
Varus.
Varus, right. So this is what? So you would see the foot like that, medially inverted. Okay? And that is what? Talibes? Varus. And the other is valgus. Okay, so we're going to look at that. But varus is the damage of the superficial peroneal nerve. Okay, so that's superficial. And then we have the posterior compartment muscles. Okay, so we have, how many muscles do we have in the posterior compartment? Totally, how many muscles?
Like 5.
4.
Okay, 3 superficial and 4 deep. So superficials are gastrocnemius, soleus, plantaris. We have 3 muscles. And then we have deep muscles, which are tibialis posterior,
Flexor.
popliteus, flexor hallucis longus, hallucis longus, and the other is flexor digitorum longus. Okay, so those are the muscles that we have. So basically, so what do we have here? So all these muscles are innervated by which nerve? Tibial nerve. And this compartment and this area is basically vascularized, supplied by which artery? Posterior tibial artery. Okay, good. And the function of all these muscles are what? They do plantar flexion. So this is my foot. This is the dorsal part. This is the plantar. So we have the dorsiflexion, and then we have the plantar flexion. Okay, so plantar flexion, dorsiflexion. So this, the posterior compartment muscle would do what? Plantar flexion. Okay, it would do plantar flexion. So dorsiflexion, plantar flexion, or extension and flexion. So these are important in which particular circumstances or activities?
Walking.
Jogging, walking, running, all those daily routine activities done by these 2 compartment muscles, which is important. Okay, the other thing of these muscles is that, as you can see, all these muscles, they pass, so we have a flexor retinaculum on the medial side, and all these tendons basically